You get all future correspondence related to our multidisciplinary webinars. All right, it is 10:02, so we will go ahead and get started. Good morning, everyone, and welcome to our System Impacted Youth.
I know that's true. Another thing, there isn't the SSO walk-in that came in yesterday that we
Sorry about that. Again, welcome to our System Impacted Youth Multidisciplinary webinar. This is our webinar topic for the month of July. Again, just as a reminder, please be sure to mute yourself and maintain mute throughout the duration of the presentation. If you have a question, there will be an opportunity to ask questions. So please just raise your hand and our moderator will be sure to call on you once it is appropriate to do so. Please be sure, again, to put your name and your organization in the chat box so that we can record your attendance. And if you'd like to be added to our listserv, please just indicate that in your chat message, and our staff will be sure to add you to our listserv. So just a little bit about this webinar series in case some of you are new. The webinar series is intended to provide an opportunity for our local organizations to engage with experts that work in the field of homeless services and to provide advocacy tools and resources to our agencies. So we hope to provide topics that are germane to the work that we're doing as homeless service advocates and housing advocates, are always welcoming suggestions for new topics. So if you have a topic that you would like for us to cover, or you're interested in presenting about the services or best practices of your agency, we welcome you to reach out to our agency and we can coordinate a month and a topic based on your expertise and what you'd like to see. So please, we encourage you to give us feedback we really, really do want to provide information that is useful to all of you. Next slide, please. And for those of you who do not know me, my name is Emma Perez-Singh. I'm the Administrative Services Manager for the Continuum of Care, and it is my pleasure to welcome you again to our webinar and to welcome our speakers this month. We are very fortunate to have Judy Nightingale, who is the Director of Population Health for Riverside University Health Systems, and also Ismael Davila from UC Riverside Underground Scholars. He is an abolitionist educator who will be presenting some very, very interesting information. Before we get started with our speakers, it is my pleasure to introduce Karen Roper, who is our new COC chair. We are so excited to have her. She is the Corona Homeless Solutions Manager, and Karen would like to say a few words before we get started. So Karen, please.
Thank you. Good morning, everybody. I'm so thrilled to be here. I'm not new to you. I had the privilege of serving as your vice chair for 2 years, and now I'm thrilled to function as the chair, and I'm here in a servant leadership position. My goal is to serve all of you. So we are excited to focus on this particular topic, and it is very near and dear to my heart, because when we're looking at a high-functioning system of services, we really do need to focus on justice-involved clients. And I just wanted to make a plug to all of you, if you were not aware of this, to remember that we do have a Continuum of Care Policy Advocacy Committee, and it has working groups. And there's one working group in particular that is related to this webinar, and that is our re-entry working group for those that are justice-involved in our system. And so we focus on a lot of different policy issues, challenges, barriers, opportunities, partnerships, really everything that we can do. So if you guys are interested in diving deeper into the issues regarding re-entry, I hope you will consider that. You can leave your name and contact info in the chat if you'd like to get involved, and I'll coordinate with the staff from the county to make sure that you guys get invitations to the working groups. And I'm thrilled to hear from the speakers today. And with that, what I would like to do is give a warm welcome to Judy Nightingale. So Judy, the floor is yours. We're so excited to hear from you.
Thank you so much for that kind introduction. I really appreciate it. So I'm excited to be here today to talk a little bit about a program that we have had in place for 6.5 years approximately. And we found some really great ways to help people in the justice involved population. If I can have next slide, please. So whole person care was part of the 11/15/2020 Medi-Cal waiver that came out in 2015 and was scheduled to last for 5 years. Due to COVID, it lasted 6. We did not get started with whole person care until the October of 2017. And our goal, according to DHCS, was to improve care and care coordination for very complex patients and to get the patients in the right place at the right time so they could receive care. We focus specifically on the justice involved population coming out of incarceration, and each county of the 22 counties in California did have a different focus. Next slide, please. So what we did here in Riverside County was we hired 8 nurse screeners into all 9 of our probation sites, as well as the 2 parole sites. We also had RNs and 2 wraparound Prop 47 clinics that were run by behavioral health. And we also hired a dozen housing outreach specialists who reported through behavioral health to Marcus Cannon, whom many of you know, probably all of you. Additionally, we hired nurses that were care managers that were in each of our community health clinics. And very wonderful for us was the fact that a lot of the probation offices are very close to our community health care clinics and RUHS. And so that made it really convenient and very easy to refer these individuals who needed physical health care. I also hired 2 RN managers to provide oversight to the team of nurses, as well as a program coordinator that kept me sane and kept DHCS happy by providing the deliverables in our goals and our numbers that we reached. Next slide, please. So what we screened for was for mental health, physical health, substance use needs, homelessness, insurance, including Medi-Cal, and we made referrals. In most cases, as much as we could, we had warm handoff referrals so that we connected the client that we were screening with those services. We had a process by which the nurses would follow their screen with the first screen done by the probation officer. So normally when someone exits incarceration, they are scheduled to show up at the probation office 48 hours post-release. And so the PO takes the intake at that time, and at the end of the intake would walk the person down to the whole person care nurse and would tell them, next, we're going to see the whole person care nurse, and she will get you connected to these services. The nurse would then screen the individual. Actually, first, they got a consent from the individual. They explained that the state had paid for them to be present to help individuals access physical, mental, and substance use care without the need to go to the emergency department. And then they asked them to sign a consent form that was segmented out to each of these different screening functions and departments. And then they also asked the probationer to sign a consent to allow us to be able to speak with the PO if an individual had a scheduled appointment but did not show up. So our acceptance of screening was at 96%. 96% of the clients we offered the screening service to accepted our services. Next slide. So whole person care as of January 1st this year transitioned into CalAIM. CalAIM absorbed the funding that was previously being provided to whole person care directly into the county, as well as funding for health homes that was previously provided from DHCS to IEHP. And so now both of those whole person care and health homes programs have transitioned into CalAIM Enhanced Care Management and Community Supports programs. And this is the focus that allows us to enroll patients into our community healthcare clinics enhanced care management programs. Additionally, behavioral health is providing community supports and also providing enhanced care management to people with SMI. We have frequently shared these patients or clients between behavioral health and community health care because frequently they have behavioral health needs as well as physical health needs. Next slide, please. So the barriers that we found after coming out of incarceration, the biggest barrier was that these individuals do not have active Medi-Cal when they are incarcerated. That's actually, I believe, a federal CMS requirement. And so what happens is when someone's incarcerated and then they come out, well, let me start by saying at baseline, before we started whole person care, what we found was that out of the people that were eligible to have active Medi-Cal, only 5% of those people in probation that were eligible for Medi-Cal had active coverage. When we were at our peak before COVID started, we were up to almost 65% of eligible people who could apply and have Medi-Cal benefits who had active benefits. So what happens is when someone comes out of incarceration, they don't have active Medi-Cal and they don't have a relationship with what is referred to as an MCP, which is a managed care partner. And that in our county is IEHP and Molina. And so CalAIM, with its funding coming out, has required that for people to be able to access funding reimbursement for patients they care for, they must have an active affiliation with IEHP or Molina, not just having Medi-Cal. So you have to understand that when someone comes out of incarceration and they don't have Medi-Cal, that is about a 3 to 4 to 6 week process to get active Medi-Cal after they complete an application that's about 30 to 45 minutes long online. DPSS helps with that application and they have eligibility technicians that can assist with that service. So it takes 4 to 6 weeks to get active Medi-Cal. And then once that individual has active Medi-Cal, then they need to apply for an MCP affiliation with IEHP or Molina. So you can see that process usually takes 2 to 3 weeks. We're looking at about 2 months for that process to be in place after release from incarceration. So initially with whole person care, because the state did allow us to screen and provide assistance before that person had active Medi-Cal or even MCP coverage, we found that there was a huge need for all medications to be available to these individuals at release. And so we immediately started a new program where we asked for the physicians that are providing care in detention health to please give people 14 to 30 days worth of medication, because we found that we had a lot of people that were running out of medication and didn't have Medi-Cal to pay for that medication, and therefore were just going completely without it. Next slide, please. So I guess I went through all this already, so we can go to the next slide. So this was interesting to us. The statistics when we were writing our request for money from the state for whole person care, this was a new population for me that I really knew nothing about. And so as we were finding information, we identified that there were 15% of the jail population who were homeless prior to arrest. That percent was 7 to 11 times higher than the general population, but I'll tell you, I think it's very underrepresented of the true population coming out of incarceration that is homeless. We started by asking people if they were homeless when we were screening them, and they all said no. So I asked my team to ask a different question, and they started saying, "Where do you sleep at night?" And when we asked that question, what we found was that people were sleeping on someone's floor, in their garage, on their sofa, and we considered that to be at risk of being homeless or underhoused. Next slide, please. So we all know that in the post-incarcerated population, the social determinants of health are very much higher than those in the general population. We know that at least 40% of people going into incarceration have a mental illness and have been in jail or prison at least once in their lives. We also know that 45% of inmates in the local jails and state prisons have a co-occurring mental health and substance use disorder. Additionally, we were very concerned because as we were studying more about this population, we found that the risk of death during the first 2 weeks after release was literally 12.7 times higher than Washington state residents in the same age, race, and gender. And so considering going back to the barrier, as I was discussing, having active Medi-Cal benefits with IEHP or Molina, if your highest risk of death is during the first 2 weeks post-release, then it's not ideal to wait for 2 months to be able to get managed Medi-Cal. Next slide, please. So we also know that there's a high risk of recidivism back into jail in the population who has been there once. And so our overarching goals for the Whole Person Care Project were to reduce reincarceration and additionally to assist people not to have to go to the emergency department for physical health care, because generally when someone waits that long, they're sicker and then they need to be admitted, and it's not ideal. So we really wanted to reduce recidivism and unnecessary emergency department use. We knew that during the first year after release, about half of all of the probationers in our county do return to incarceration, and often most frequently due to substance or alcohol abuse. Next slide, please. So we know that there are high health needs. I think I already spoke about this, substance use and SMI. You can see I underlined a couple of salient points around the dual diagnosis population. And we also know that poor physical health is much, much, much higher in this previously incarcerated population. They have much higher rates of all of the communicable diseases such as HIV, AIDS, TB, hepatitis C, as well as having more chronic health conditions such as asthma, cardiovascular disease, diabetes, etc. Next slide, please. So I think I already went through this actually. So I worked with Renee Suave before she retired from DPSS last December. Whole Person Care paid for 2 years of eligibility work during incarceration prior to inmates leaving. And those individuals were able to eligibilize a lot of people so that when they came out of incarceration, their eligibility for Medi-Cal was already found to be that they could get active Medi-Cal benefits. And so then when they came out, it was a lot easier to just go ahead and make that paused access to eligibility in Medi-Cal. We could turn that back on, take them off pausing that coverage, and then we only had to reach out to IEHP and or Molina to get them signed up for that active Medi-Cal. Renee and I wrote for 2 requests for policy change to CWDA, which is the oversight body for social services at the state level. And what we requested was the ability to do eligibility at entrance into incarceration, and then to suspend that eligibility during the time they're incarcerated. Currently, annually, people who have Medi-Cal have to sign up again every single year, unlike those of us who work in the county or elsewhere where we automatically have our insurance coverage rolled over. This population has to fill out that application that takes a half hour to 45 minutes every single year. So what we asked was that CWDA would allow us to eligibilize people at entrance into incarceration, suspend the coverage for 3 years instead of a year, and then allow us to have presumptive eligibility with an MCP for that first 60 days after release. We have not heard officially back on either of those requests, but it does appear that the eligibility work in our county jails is moving forward because our own detention health, sheriff, probation, and others are working together, including behavioral health, to make an improvement in that process. Next slide, please. So these are the things that we measured. We measured many more data elements than what DHCS required us to measure, mostly because I do have my doctorate in public health and I love research, and I knew that I wanted to be able to measure certain outcomes that represented a reduction in cost, usage, reincarceration, use of emergency department. So we really wanted to track those referrals that the team made and whether or not people showed up for those referrals, and then the ability to look back and see what factors improved those people's reduction in reincarceration and ED use, and what seemed to be combining factors that even made them more successful. Next slide, please. These were the partners that we started out with who helped us with this, setting up the writing of this program. I had 3 months to work with as many people as I could include to set this program up, and now we probably have way more, probably 30 or 40 partners. Next slide, please. This is our whole person care data and how many people we had screened during the program, and this was just it was prior to pandemic, actually, because in April of 2020 we did have to start helping out some with the COVID activities, and that dropped off a bit. This says 12% declined, but that includes our data around a rescreen at 6 months and a rescreen at 12 months. And so those numbers are calculated in the total decline. But as far as first round screening and linkage, we did have a 96% acceptance rate. Next slide, please. So our outcomes, I think I mentioned the increase in active Medi-Cal benefits. Additionally, what we found, and I had a doctoral student at Claremont Graduate University who did his dissertation work on our whole person care data. And what he found was that when my nurses referred an individual to behavioral health, and that individual showed up for just one appointment for serious mental illness, the reduction in their reincarceration was up to 65%. And when we referred people over for substance use disorder treatment, and they showed up to just one appointment, their reduction in reincarceration was up to 50%. And so we did see a significant drop due to the upstream screening and linkage to services these individuals needed. Next slide, please. So we were able to also achieve these outcomes. We improved our partner relationships, which was extremely helpful when COVID came. Tanya Torno was running a program funding for people who were at risk of homelessness or were homeless, who had a physical health condition that put them at higher risk for COVID. We were able to quickly assist her in that space because we do have RNs that could do that health screening and then confirm that someone was at risk, higher risk of COVID. And so that partnership was already in place, and it made it much easier and quicker for her to be able to get some help in that space. We also found that we reduced a lot of duplication of efforts that multiple departments had in place. And the biggest thing of all was we had a lot of really grateful clients who were able to not go back to incarceration and have thanked us profusely many times. Next slide, please. This is just a total now through the end of May, how many screenings have been offered and how many have accepted. Again, this includes our 6 and 12-month rescreen, but you can see that we've done 14,000, almost 15,000 screens now. Next slide, please. Oh, next slide, please. So this is just a total number of how many screens, how many referrals were made and by site. So if you look at the top line, or let's look at the bottom line, you can see that there were a total of 4,300 plus referrals to our care managers. That represents the population that the screening nurses felt needed extra care from a care manager to connect with the referrals that had been made for those individuals. The next column shows that one of our highest referrals was for physical health, and then substance use, behavioral health, housing, social services included Medi-Cal and CalFresh and Cash Aid. And one of our favorite programs is TAY. I think out of 53 people who were referred, all 53 have been successful in not going back to incarceration. Don't quote me on that because I have to double check, but last I knew that was true. Next slide, please. I agree, clapping. So do I have time for a quick success story?
Go for it.
Okay, cool. So this is one of my favorites. We have a file full of success stories that are just incredible. But we had this gentleman who came out, and Marcus's team of housing outreach specialists were just tremendous. As this housing outreach person was interviewing this client, he asked all of his questions for the VI SPDAT. And when he came to the question about being a veteran, he asked the client, "Are you a veteran?" And the client said, he hesitated, and then he said no. And so at the end of the intake, the housing outreach specialist said to him, "I noticed that when I asked you if you were a veteran, you paused and then you said no. Can you tell me why?" So this gentleman said, "Yes, I went into the service when I was 17, but I lied and I said I was 18. And when I was 19, they found out that I had lied. They kicked me out and told me I'd never have access to veteran assistance." And so the housing outreach specialist said, "You know what? I don't know if that's true. Let me check on that." So he reached out to our Veterans Affairs office, and they said, "Absolutely not. We can house this gentleman." So this guy had really bad heart function as a result of many years of methamphetamine addiction. And his ejection fraction, something that probably only a cardiologist knows what that means, but his heart was functioning so poorly, he was at less than 10% ejection fraction. And so as a result of that, the physician had given him a defibrillation vest. And it was great because it shocked his heart when it stopped beating, but he was homeless, and it's hard to plug in and recharge a defib vest when you're homeless. He and his girlfriend did not like going to the shelter because his sole support system was his girlfriend. And of course, they separated them into men and women's areas to sleep in the shelter. So he was really struggling and having a very difficult time. So as a result of this astute housing outreach specialist, this gentleman was giving housing. He was able to get his cardiac function back up to over 35%. He was able to quit wearing his defib vest. He has been successfully out of incarceration again since that time. He and his girlfriend got married, and he is just one of our best success stories. We really are so grateful for all the people that my amazing team helps. And then next slide, I don't know if I have any more. It's just questions. Yeah, okay. So thank you very much for your time. I appreciate it.
Thank you so much, Judy, for that presentation. I hope everyone found it helpful. We're going to go ahead and take questions for both presenters at the end, just to make sure that we have enough time for our other presenter. So next slide. And then Judy, if you want to put your information in the chat in case people want to reach out. I know it was on that last slide. We're going to go ahead and give the floor to Ismael Davila. And he is going to share his screen. So Mar or Mel, if you can give him access if he needs it. Okay, great.
Can you all see that?
Yes.
Okay.
Yes.
Wonderful. Hi, everyone. It's a pleasure to be here. My name is Ismael Davila. I work at the University of California, Riverside, where I am the director of underground scholars there. I myself am formerly incarcerated. I've grown up here in the Riverside area my entire life. I grew up in Rubidoux, California, and that's where I ended up getting incarcerated for something that happened there as a 19-year-old. And I've gone through my higher education afterwards. Now, like I mentioned, I am the director of Underground Scholars. Some of you may not know what Underground Scholars is, but I'm here also to kind of enlighten you on that and the services that we provide as well. So what is Underground Scholars, you may be asking? Well, Underground Scholars is a program that first started at UC Berkeley as a student organization, I believe in 2016, by other formerly incarcerated students, because they found that they did not have support groups or people that could understand their situations and the life that they were going through after incarceration. So they band together to provide peer support, mentoring, opportunities for each other to be successful and going through the higher education process through graduation. And then 2018, the UC Berkeley had the first program that was funded, and then it trickled down to the other UCs. In 2018, UC Riverside developed its student organization there. And then this year we received funding, and by we, I mean our students with their advocacy at a state level advocated for UC Riverside to receive some funds from a grant, and they got that money from a grant, and that's how I'm here. I previously worked at Riverside City College with youth who were incarcerated and adults that are incarcerated, so I have close to a decade of working with people who were incarcerated and formerly incarcerated in my experience. But I'm the new director, and Underground Scholars is specifically for our formerly incarcerated and system impacted students. So we work with our formerly incarcerated here on campus to ensure that they are successful through higher education. We work with those in the community, whether they are interested in going to school or if they're at a community college. And we also work with those who are incarcerated, and we guide them through the steps of higher education. But in my experience, because we're here talking about some things, and it's about youth homelessness or houselessness, excuse me, in particular, I did want to share this quote by Audre Lorde, that there is no such thing as a single struggle because we do not live single issue lives. And that really relates to what we're talking about here with our youth who are previously incarcerated and currently incarcerated, because they face a lot of barriers after their release. And one of the barriers that they face is they actually, once released, they're placed back into the housing sometimes, if they do have housing, which led them to be incarcerated, which can be problematic. But let's talk specifically. I may go a little bit faster because I want to include Seraphine, a colleague of mine as well, and a good friend of mine, to provide some insight because of his work as well with youth. So I'm going to probably move a little faster to be conscious of time. So we do also have questions. If you do, we can answer them. So please forgive me. But houselessness and youth in the carceral system at a national level, about 44% of youth have stayed in a jail, prison, or juvenile detention facility. At least 78% of those youth had at least one interaction with police, and nearly 62% have been arrested. Black and Hispanic youth, as well as our LGBTQ community, are those youth who are houseless and or involved in the justice system. I should correct that. I should say carceral system, because justice is actually just a relative term. But in our county specifically, we have a high population of Latinx youth who are incarcerated and mostly male, which is based off of the demographics of our Riverside County as a whole. And with my experience working with the youth directly in all 3 of our local juvenile halls. Youth lack safe and stable housing, become involved with law enforcement and the justice system in many ways. So some of our youth lack stable housing because it's unsafe for them to be at their house, especially our LGBTQ community. Sometimes they are kicked out of the house or don't feel safe in their homes. Some of our other youth have very toxic home life, whether it be through substance abuse, or excuse me, I shouldn't say substance abuse, drug addiction, alcohol addiction, domestic violence. These things that lead them to wanting to leave their household and potentially living with friends, couch surfing, or potentially houseless. For youth here have been kicked out of their home for various, like I mentioned, unsafe conditions, find themselves without places to live. So let me see if I can minimize this. There we go. Shelters are often not an option, as we previously mentioned. With that individual as an adult, he didn't feel comfortable being separated from his partner. But in addition to that, beds are limited, and it's very hard for our youth to go into these facilities because, as we do know, even with adults, with all people in general, there is a stigmatized for being houseless and identifying it, and that's why individuals choose most of the time not to openly self-identify. It's a challenge because we still stigmatize those that don't have a house. So this is one of the challenges that they face. So one thing that I did want to mention as well is it's also challenging for our youth who are previously incarcerated, because a lot of these facilities that take youth for transitional housing or housing in general to allow them to live there do not particularly take youth that have been incarcerated or have a record. And by youth, I mean all the way up to the age of 24 individuals, which some of that may change because of AB 12 or 212, which allows youth who have been incarcerated and through probation to qualify for foster youth services, but it's not for all of them. There are long-term impacts of youth helplessness and justice involvement that I'd like to talk about as well. So houselessness youth are more likely to experience mental health and substance abuse issues, victimization and justice involvement. So obviously in areas, individuals aren't necessarily allowed to be in certain situations or places and will be asked to be removed from law enforcement. So sexually transmitted infections and unplanned pregnancies. Education and employment is obviously a challenge for those who are houseless. Education makes it much more difficult to focus on these things and to become employed when you do not have stable housing or safe housing. So justice involvement, particularly secure detention, has been linked with later involvement with the criminal justice system. So in our county, about 80% of our youth are recidivists and return back to our local juvenile halls. And in addition to that, I would say from my experience of working with these youth close to a decade in our county, about close to 50% end up being incarcerated as an adult for various reasons. So they have physical and mental health problems, as we're probably all aware of adverse childhood experiences, and the furthering research that's being done with this. It affects educational attainment, health as an adult, so many other things, mental health as well. Poor education outcomes, as I mentioned, because how can one focus on education when they lack stable and safe housing? So this is a huge barrier as well, because as we know, there are still jobs, or most jobs require a GED and high school diploma. But how do we expect our youth who are released and now houseless to obtain education without the proper support and structure there, especially if they are houseless? Difficulty in the labor market later on in life. Again, that's pertaining to them not being able to graduate high school, earn a GED or a high school diploma. So youth who are houseless may also commit survival crimes. And what I mean by this is most crime in general are committed as a form of survival. That's what the research shows, whether we choose to believe that or not. But most crime is committed out of active survival. So our youth are doing robberies and thefts for either food, for things that they can potentially sell so they can survive, to provide things that they need, such as clothes, shoes, food to eat, these everyday necessities and things that we take for granted. And we just assume individuals are committing crimes because they want to commit crimes, which is a big misconception. And that's also for adults as well. It's a huge misconception, as most adults aren't out there just committing crimes just to commit crimes. And I'm not saying that there aren't individuals that potentially are doing that out there, but most are not doing that. May also be victimized, our youth, for sexual exploitation, labor trafficking, enter the justice system through charges related to that victimization. So this is also highly, highly important to consider when we talk about our young women who are incarcerated. Most of them are incarcerated for their safety, which is so ironic that we're going to incarcerate someone for their safety, especially if they're being exploited for various reasons, whether it be for sex trafficking or labor trafficking or whatever it might be, that we're incarcerating because we think that that's going to be a safer environment for them to go into. And most women aren't committing violent crimes or anything like that as well. So it's just a really interesting take on why we're incarcerating, especially our women, for their safety. And it's so strange because we know that the outcomes after incarceration are just much more or worse for those individuals, and the impact that it makes. Youth are wary of self-identifying, as we heard earlier. Even the adults are, because of the stigmatization that comes with identifying as being houseless. So I enjoyed hearing the question and how it's reframed and asked where individuals were sleeping at night, because that is a great way to see if one is houseless, because one's houseless if you don't have stable housing, sleeping on a floor or garage or on someone's sofa. But these are some of the things that I have. We do have questions here, but I would like to say that at Underground Scholars, we work really closely with our formerly incarcerated students on campus, with outside partners and agencies for housing, for mental health services, for anything you can think of. We have relationships and partnerships with tons of different departments, agencies, and nonprofits that we work heavily with and closely with. So we are able to assist. I just assisted one of our students just on Tuesday. That's why when I had a struggle trying to do this presentation, because I've been very busy. One of our students was houseless and was couch surfing from place to place and living out of their car, and was denied housing here at our college. So I had to go and advocate for them. We found resources and we were able to get them housing. But these are things that we deal with and talk about on a daily basis. So I also want to open the floor for Serafin, because I consider him to be an expert on this field, and he's also a colleague of mine. So Serafin, if you have anything you'd like to add, please feel free.
Good morning, everyone. It is a pleasure. My name is Silvestre Serrano. Serafin is my younger brother. That's okay. That's okay.
I apologize.
That's okay. That's okay, brother. That's okay. I am formerly incarcerated myself. Grew up in LA. Paroled about 3 years ago to Riverside, actually. And you know what? Luckily, before I got released, there were people, staff in prison helping me set up Medi-Cal, where I was gonna live, and I know that was very important for my transition. I believe, however, that lacks with our youth. Our youth, like Ismael and other presenter stated, they come out, they are lured with temptations from their old acquaintances, from girlfriends, boyfriends, the police are triggers, even family, believe it or not, ladies and gentlemen, could be huge triggers within our household, because our families, there's trauma, generational traumas that we have not addressed, and they need not AANA meetings. They need mental health services. They need recovery circles. They need support services. They need to go into places where we're able to talk about their traumas. And not only our youth, but our parents, the parents of our youth, because they're still wounded, they're still suffering. So how can we help repair the wounds of our children, of our students, but send them home to a house where they're still in there, when they're still dealing with trauma themselves? So I think we need to address and help our parents as well. So they also need services. That's something that I believe that we can achieve. These things that our youth face upon being released is also going back, like Ismael mentioned, going back to the neighborhood. That's not safe. They need to be somewhere where they're housed, where it's away from where they grew up, where they're around other men and people that are supporting them, that are providing them with resources, that are providing them with education, with a job. A job will keep you busy, will keep you tired, and put some money in your pocket, will make you feel independent, will make you feel responsible. And those are things that we need to keep them occupied. But if we let them out, they're going to go back to the same place, doing the same thing. And then, like Ismail again mentioned, a lot of them come, using medication, right? Whether they used it prior to incarceration or while incarcerated, they were diagnosed with a certain disorder, and they were placed on medication. They become dependent on it. They come out here. They want to continue to support their habit, and of course, they resort back to what they know best. And maybe they have issues with family that they don't want them back at home because of domestic violence or substance abuse. But we need to be reminded, ladies and gentlemen, that gangs, violence, drug use, alcoholism, incarceration, risky behavior, those are not problems. Those are the symptoms. The problems are the incarceration, the abandonment, the neglect, domestic violence, death, substance abuse, divorce, those ridicule, those are the things that our youth are suffering with, and we need to get to the core, and we need to address it so they begin to heal and help their families heal, so we could break this cycle of them being incarcerated. Because these children, as you know, they're gifted, they possess many qualities, they just don't realize it. And it is up to us to present it to them, show them that mirror and say, look it, this is who you are. Once they know their worth, their self-value, their self-esteem will lift up, their confidence level, and they will begin to recognize who they really are and cherish themselves, and then be able to contribute to our society. So I'm just thankful. I thank you all for just listening. For Ismail, thank you just for these few minutes. Thank you very much.
Thank you so much, Silvestre, for being on this call, for sharing, your wisdom and your experience. Same thing with Ismael and Judy. Ismael, anything else to add to your presentation? And then we'll ask for questions.
No, I was just going to leave it up for questions. Please forgive me that it went fast, but I did want to leave room time for questions.
Okay, awesome. So if anyone has questions at this time for either of our presenters, go ahead, Karen. I see your hand up.
Thank you so much. First of all, Ismael and Sylvester, I just want to thank you both so much for the inspirational, what you had to say about just talking about your lived experience is so powerful. And I know that what you do and when you share that is powerful for our youth. So I just, from the bottom of my heart, I want to thank you. It was very moving. I also wanted to ask you both if you do partner with other colleges and universities. And the reason why is because I do partner with Norco College, and they do have a program where they help homeless youth. And I would love to connect you guys because I think that there could be some really great collaboration. So I just wanted to throw that out there and ask you if you're already doing that and if I would be able to make that connection to you guys.
I do partner with all of our local community college and four-year schools in the area. I have a consortium for the programs, but I'd love to be able to speak to whoever, and I'm sure Sylvester would also like to speak to whoever, because he's in the Corona area as well, to that individual, if we can be connected so we can provide better assistance and support.
That would be great. His name is Mark Hartley, if you haven't met him already, but I'd love to make the connection and have follow-up discussions. Thank you, guys.
Thank you.
And then if I may just add onto what Karen said, I know she mentioned it earlier, but we do have a policy advocacy committee and we are always seeking new members. We have a few different categories: health, system impacted, youth, housing. And so if anyone is interested in joining one of our groups for our policy and advocacy committee, Ismael, Silvestre, we'd love for you guys to join our system impacted group. And then Josh, if he's on the line, just go ahead and put your info in the chat or email us at coc@rivco.org, and we'll go ahead and get you connected. One more thing that I wanted to mention, and then we'll ask for more questions, is if you have youth that want to get connected, I do run a youth action board through our continuum of care. It's for those that are 18 to 24 that have experienced housing instability or homelessness, couch surfing, and it's for youth 18 to 24. And as long as they reside in Riverside County, we provide a stipend, and we really want them to share their experience and knowledge at the table, including our COC meetings, sharing at webinars, during youth advisory committee meetings. So we welcome all youth with all walks of life. So if you have any youth that are interested, please get them connected. I'll put my info in the chat. And then we do have 2 hands up, Gina and then Greg. Go ahead, Gina.
Yeah, hi. I'm curious. There was discussion about not returning the child to their original home. Where do they go? I mean, we're so ingrained with, if they're under 18, they have to be with adults and things like that. Where do they go?
That's a good question. No, that's the hard part, because obviously I prefer them going back to their family, but sometimes their household at home isn't the safest and most productive environment. And not just even outside of their household. I believe Sylvester would feel the same way. From the communities we grew up in, when I would go home, I have my family who were in gangs, my cousins were in gangs, my friends, everybody on my street was in gangs and has been incarcerated. So all it does is put me right back into the situation where I got incarcerated for, and back into that environment, which you end up seeing with youth who are incarcerated. They're released back into their household, into their community. And that community is the same community that led them to get into trouble, because it's that lobster effect. You might be trying to crawl out of the boiling water, but someone's going to pull you back into that boiling water.
Good word picture.
Thank you for that question, Gina. Always lovely to see you at meetings and have your input. Go ahead, Greg, and then AJ.
Gina.
Yeah.
I'm sorry, real quickly. I'm sorry. This is Silvestre. I'm not sure. They're for adults, they have transitional housing upon their release, which is, it could be 6 months, it could be a year, where they stay, where it helps them to integrate back into society. Our youth also need that. They also need to go to a place where it's a housing, it's not a prison, it's not a detention center, it's a normal house with rooms, but they have chores, they have groups there, they have staff that are there 24/7, different shifts. They interact with them, they help them, with the process of getting their driver's license, birth certificate, social security, all the things that they're going to need to, get a job, go to enroll in school. And that is the place where I think will be very beneficial for our youth as well.
Do you have enough space for all the kids that are coming out?
No, I don't have I wish I had the location. I'm suggesting that that's what we need more of. We need more of these in Riverside and San Bernardino County.
Okay. That's kind of been my late focus, is trying to find housing for them to go to. Not necessarily just children, but in general, the homeless population. So that's why that was forefront on my mind, is where do they go, So we got a lot of work to do. Thank you
for that. Thank you so much for that conversation. Go ahead, Greg, and then AJ.
Yeah, thank you. Sorry, I'm driving. My question and comment for Judy is, first of all, I've seen Judy at the very beginning of this program. kudos and applause to her amazing team on how successful it is. But Judy, I want you to address if there's any capacity or financial resource challenges in order for these programs to move forward within the county going forward.
Yeah, that's a great question. You know, I don't think we will ever get to a point where we've got sufficient housing. And that is the biggest challenge I think that we face. And even if we have enough capacity for housing, having affordable housing or having assistance for housing, I think, you know, it's just something that we continue to really struggle with. I went out to Palm Springs or Banning yesterday, and you know, I noticed the tent city along the freeway in Banning, and those kinds of things are just, I don't need to tell you all because I'd be preaching to the choir, but I just really think and hope and really cross my fingers that we're able to help this homelessness population. And then also, I really hope that we can move away from incarcerating people who are addicted. I think if we can find some better substance use, sober living, and situations for people who have addictions, I think they'd be better served outside of incarceration. And I know behavioral health has resources for that. I can't speak to whether they need more resources. I do know that we all need more housing.
I would agree, and I would venture to guess, and I don't think I'm speaking out of turn, that behavioral health does need more resources, especially since our county is robbed of $150 million a year. But additionally, too, is I think these recovery villages that Dr. Chang and Marcus and Ryan really championed and are opening are going to be a key tool in the substance use aspect that you bring up. So thanks again, Judy, for the great work.
Absolutely. Thank you, Greg.
Thank you so much for that. Judy, you're amazing. Go ahead, AJ, and then Robin. And then if anyone needs to hop off, please feel free to do so. We're going to send the recording after the meeting and upload it to our website.
Good morning. So sorry, I was about to log off, but just real quick to answer Gina's question earlier. So Operation Safe House operates a youth shelter for 11 to 17-year-olds. We do have a screening process, so if they have a prior arrest history or anything like that, it's all on an individual case-by-case basis. But what we try to focus on is not only on the youth, but also the family as well. Try to repair the family dynamic so that way, you know, the youth doesn't feel like they have to run away from home or whatever the situation is. So yeah, for more information, because I unfortunately do have to run, feel free to reach out. I just put my cell phone number in the chat. But yes, good meeting. Thank you.
Thank you so much, AJ. So yeah, if you need to get a youth connected Operation Safe House, let us know. Email our COC, email AJ, and Operation Safe House is our TAY shelter, and they support our youth tremendously. So if you have a youth that's in need, please send them over to OSH. Go ahead, Robin, and then we'll end there. And if there's any more questions, please feel free to reach out to individuals or email us.
Good afternoon. Thank you so much for the opportunity. Love to hear everything that's going on. Although I work in housing, I do have a master's in developmental psychology for children. So just hearing the stories is kind of like a repetitive cycle. And it's great to hear people who've been there and done that can actually pull back out and help those who are currently going through that. I did want to mention, I'm not quite sure if you're aware that HUD actually released, I believe it was like $15 million for youth services. It's supposed to begin this fall. I'm not sure if you all are able to apply for that. I do know that there is a lot of eligibility, and I think that once we really do get down to how you can help those without having those barriers, because if you have a felony, if you have misdemeanor, certain things, you don't qualify for financial aid, you don't qualify for housing, you don't qualify for certain things. And of course, if you come from that background, you're never going to really be able to get out of that situation if you don't qualify because of your past. And so those are just the two things, just making sure that we are that we are advocating that, look, in order to really get these people the help that they need, we need to make sure that we are, you know, kind of like you said, on a case-by-case basis. Okay, we're not going to say you don't qualify because you have a felony. Well, let's look into that. Let's delve into that and see if there's a workaround. We can't just deny financial aid because of that. But my main question was for those who are dealing with the youth and getting them housed, are they aware of the funding that HUD just released for the youth program services itself? And if not, if they can look into that and see how they can actually get on board to assist others utilizing that funding.
Thank you so much, Robin, for that. If you do have any information, right, a link, the article, the HUD release, a NOFO, something like that, please feel free to send it to myself or our COC, and we'll go ahead and share that with our presenters. And then also, I know Griselda was on here. I'm sure she's looking into it, but I'm sure it's something that we can also bring up at our policy advocacy meeting. So we will look into that, and I'll make a note of it.
And I'll also send it to you directly.
Awesome. And I'll go ahead and share that with our partners on this webinar, as well as our Policy and Advocacy Committee and our presenters. Thank you so much, Robin, for that.
If I may address something to provide some clarification. Everyone can qualify for financial aid regardless of a previous conviction. That question that was specifically related towards drug convictions, and only if you're receiving financial aid while you were convicted for a drug offense, and now that has been removed as well. So everyone can qualify for financial aid. If anybody needs any assistance getting somebody to qualify for financial aid and going into higher education, please reach out to me.
You all are awesome. Thank you so much, Ismael, for adding that. If everyone is good to go, we're going to go ahead and end the recording here. Thank you so much for coming out to this webinar. I'm excited for next month, so please look out for that email and that invitation. Thank you all so much again for all the great work that you all do and just being on this webinar and getting that info. Thank you to our presenters.